Right, Diksha. Let's continue our most interesting discussion again. Right. So previously we were discussing about that is MCI is mandatory for FMGs or not. So congratulations, fine. MCI is not mandatory, but as Dr. Diksha has said earlier, that it is actually it's not easy. If you're thinking, okay, fine, you can escape from MCI and you can jump to USMLE again. एक तरफ अगर कुआं है दूसरी तरफ खाई है यू हैव टू बी वेल प्रिपेयर्ड फॉर इट है ना राइट दीक्षा
Yeah, correct. That's it. Like if you want, you are welcome to do both. I
राइट
did both.
हाँ
But if you feel you can only concentrate on one, choose one and then stick to it. Don't keep jumping back and forth.
बैक एंड फोर्थ है ना और एनीवे आई थिंक जहां तक मुझे लगता है कि एक बार आप अपना रेजिडेंसी जो है यूएस से कर लेते हैं यू हैव दिस ऑप्शन कमिंग बैक टू योर होम कंट्री एंड वर्क एज अ डॉक्टर am I wrong
Yes. Yes, no, you're completely right. But again, you still have to give the MCI exam at that time. But you are much more prepared, you're much more equipped, you're much more learned. So,
या बट इन केस अगर कोई एक आधा
yeah,
पर्सन ऐसा कैंडिडेट है सो द पॉसिबिलिटी इज 100% देयर है ना कि आप कर सकते हो
yeah,
राइट सो लेट
correct.
मी गेट बैक टू योर अचीवमेंट्स सो व्हाट इज योर स्पेशलाइजेशन अगेन
So, I did my residency at the University of Minnesota in pediatrics.
राइट
And for me, like doing the same thing again and again, I can't have the same day twice. I'm somebody who likes every day to be a new day.
राइट
So that's why pediatric emergency medicine is the most competitive subspecialty in pediatrics. So it's good because it has a great work-life balance. You don't have the same monotonous every day, same type of patients. You see different patients every day. Sometimes I see a gunshot wound in a 4-year-old, and sometimes I see a runny nose in a 4-year-old, right? This goes from one spectrum to another. I've had kids die in my emergency room, and I've kids who've been diagnosed with cancer and still lived. So yeah, it's a full spectrum. So right now I'm doing my fellowship in pediatric emergency medicine.
वाओ
Residency in pediatrics is 3 years and fellowship is also 3 years. So I'm in my 5th year, so I'm PGY 5.
salute a boss first of all right
It's
so
fine.
tell me one thing why this branch
Like I said, so for me, adult medicine is very like everybody has a heart disease, everybody has diabetes, everybody has, if you have patients who have a diagnosis already. They come in with a diagnosis versus in pediatrics, you have a long spectrum. You have neonates who are like 1 day old versus up to, so in my hospital, we see pediatrics is up to 21. And then you have a patients up to 21, which is of course half adults, but can't help it. And then you're the one who's diagnosing them with conditions. I have had diagnosed so many rare cancers, so many osteomyelitis, so many inborn errors of metabolism. We have trached and vented kids. We have kids who have VP shunts or ventricular peritoneal shunts, and cases with microcephaly, Potter's sequence, all of those. So it's just like such a wide spectrum of pathology, which like entices me a lot. Every patient is different. Every child is different. Some children are developmentally delayed. Some have autism. Dealing with these kind of patients and how your medical approach should change with every patient. Yes, you can do this in primary care clinic pediatrics, but I can't do the same day every day. So chose pediatric emergency medicine. I like the adrenaline rush. I like critical care, saving somebody's life every day. Like I said, dealing with gunshot wounds and doing resuscitations, acute trauma. All of this like is a good adrenaline rush for me. So I like that.
So it excites you basically day to day basis life में जब when you wake up you are like all excited to go to your
Yeah.
work. You are not like अरे यार फिर से जाना है ऑफिस जाना है मुझे छुट्टी चाहिए. I don't think you in this branch you want a vacation, you need a holiday, is it?
It's so interesting what you said is because I work on attending schedule. So I work only 14 days a month. Fellow is attending schedule. So you work only 14 days a month, 8 hours each shift. You go in without knowing what you're going to get. And when you leave everything there. You don't bring anything home. Nobody is going to call you Nobody is going to page you. I don't even carry a pager because it's emergency medicine. When I sign off, somebody else comes on and they will take the patient, take over the patient.
Right.
So I think honestly, the best part about my life is my job right now. I
Mhm.
love going to work. There's not one day where I'm like, she yaar jana hai. I love going to work. I'm excited. I'm energetic, excited to learn new things. Every day I see a new diagnosis. I was like, oh shit, right? Um, it's the best part of my day. I think I love my job.
Going to job, right? Right. So as we were discussing
Yeah.
earlier कि जैसे matching होती है ना US में to your branch. So just can you explain a bit about this matching thing? Like what factors actually can affect to get closer to your desired branch, and what can push you away from your desired branch?
So it's very different. It all depends on the branch you want.
Mm-hmm.
In the US, surgical branches are very, very difficult to get for foreign grads. It's not impossible. I have foreign grads, friends who are in surgical fields, but it's very, very, very seldom.
Okay.
There are 5 branches in America which are the most sought after branches. It's called, the acronym is ROADS, ROADS.
Mm-hmm.
It's radiology,
Mm-hmm.
ophthalmology,
Mm-hmm.
anesthesia,
Mm-hmm.
dermatology, and
Mm-hmm.
surgery.
Okay.
These are the five branches which are the most sought after, like they are the most competitive.
Mm-hmm.
Of course, then there is like internal medicine. There is so surgery, of course, has its like different branches, but there's internal medicine, there's pediatrics, there's physical medicine and rehab, there's psychiatry. There are all the other branches that you can pick and choose. It all depends on your interests, right? Like I was always interested in pediatrics. I hate adult medicine. It annoys the shit out of me. I cannot treat adults. They act crazy. They are non-compliant with their medications. They are
Mm-hmm.
not cute. It's not fun.
Okay.
So yeah, like pediatrics is one field where you call your patient cute, but you still won't be called to HR. Like you
Right.
cannot call your patient cute. That's one good thing
Agree.
about pediatrics, I would say.
Uh-huh.
But there are many fields. The duration of training, the duration of residency is very different for each.
Mhm.
Radiology is 4 years, ophthalmology is 4 years, anesthesia is 4 years, dermatology is 3 years. Oh, no, dermatology is 4 years. Surgery can range anywhere from 5 years to neurosurgery, which is 7 years.
Okay.
Plastic surgery is 6 years. Most other subspecialties, internal medicine, pediatrics, psychiatry, and most of the others are like 3 years.
Mhm.
Fellowship training in internal medicine is only 1 year.
Mhm.
All of PEDS fellowships are 3 years. So
Mhm.
you do 3 years residency, 3 years fellowship in pediatrics, and then you do 3 years residency and 1 year fellowship in what do you call it? Internal medicine.
Mhm.
Now, there are many other specialties you can do. Like I am planning to do a toxicology fellowship after this, which is another 2 years,
Mhm.
which I feel I would want to. I have an offer already, but
Mhm.
I'm going to think about it after I finish my fellowship. It's 2 extra years of more studying, so it's not fun.
Mhm.
But you have a lot of people just to do residency and open a clinic or like join a hospital who has a clinic and just do daily like 9 to 5, see patients in clinic. That's fine too. If that's your calling and you like that, great.
Mhm.
Most people try to go into fellowships because of course it has higher pay and it's very niche. Like there are only few of your kind.
Mhm.
Right? There are many doctors with clinics, but there are only few who do adult endocrinology or adult critical care or adult pulmonology or peds, all of those subspecialties.
Mhm.
It all depends on what you want. But when you're applying, it's very important to stick. ऐसा नहीं है कि यार अमेरिका में रेजिडेंसी चाहिए, इंटरनल मेडिसिन भी अप्लाई करते हैं, पीड्स भी अप्लाई करते हैं, फैमिली मेड भी अप्लाई करते हैं, साइकाइट्री सब कुछ अप्लाई करोगे वो आपके इसमें दिख जाएगा एप्लीकेशन में.
हाँ.
You
ठीक.
have to like modify, and you have to have your resume and your profile to a point. Like my entire profile was pediatrics. When I was applying for residency, my research was in pediatrics, my prior training was in pediatrics, everything was in pediatrics. And of course, very, very important is your personal statement. You are a piece of paper. They know you on a piece of paper before selecting you for an interview. ये आपका CV है, उसमें आपने कहाँ से मेडिकल स्कूल किया है, क्या क्या रिसर्च किया है, वो सब है. But why should somebody take you on the basis of your CV and your scores? Your personal statement. Why do you want to do pediatrics? Like, why is this your passion? That's what connects with people. Your personal statement, your letters of recommendation from America. These are the two top things that are seen in residency applications when they're selecting you for an interview. Of course, passing scores, no attempts on exams, good standing in, good marks in your medical school, good standing in medical school, no problems, no failures, all of those are also considered. But once you have applied, so the process is that you start somewhere around September, August, or I think July. Is it July? No, you start around September. This is for residency, right? You start around September. You start your application where you submit it on the portal, which is called NRMP. It's National Resident Matching Portal, where you submit all your application. If you're a foreign graduate, you have to mention your ECFMG number, and they will pull all your marks and your data from ECFMG. Then you choose which programs you want to apply. Now, applying to each program, one program is $75.
Okay.
So that is also expensive. So if you apply to 10, most foreign grads apply to at least 100 programs.
Okay.
Because you want to increase your chances of matching, right? You don't want to go through the match again. So you want to increase your chances of matching. And then once all these programs review, so they filter out. If you have graduated more than 5 years from medical school, you're filtered out. That's the norm. People say they don't do it. Medical schools, like residency programs, say they don't do it, but some programs still do. Right? 5 years out of medical school, they're filtered out. Low marks, you're filtered out. Attempts in exam, you're filtered out. Visa requirements is also different because your visa status changes when you get into residency because it's a important when it comes to the application. Once you send the application, you certify your application, and then all the programs can see your application, whichever you have applied to. They will start filtering out, or like some programs are really genuine. They review every single application. Once they have reviewed, you'll start getting interviews, which is like they either send it to your email or send it to your National Resident Matching Portal account that, hey, you've been selected for an interview at so-and-so program. Then they give you a bunch of dates where you can choose from interview. Initially, during my time, residency interviews were happening in person. So you had to fly to each program wherever you're invited for an interview. Now, since COVID, everything's become online, and it's also financially feasible for a lot of people.
Yes.
So most programs have turned, or like actually all programs have turned to online interviewing, which has been great for especially foreign medical graduates, where you can still be in India and interview.
Right.
But so interviews last from anywhere from 4 hours to 6 hours. So you can't schedule 2 interviews in the day. It's a panel of interviews. You're meeting with the program director, you're meeting with the assistant program director, and a bunch of other faculty, 3 or 4 people. You have a chance to have a group discussion and ask questions about the program with current residents. And then they sign off, they give you information about everybody's emails if you want to email about your interest in the program or if you have questions. Now, if you have interviewed at 7 places, then somewhere around December or January is the rank list.
Okay.
In the National Resident Matching Portal, you put the rank list about where you want to match the top. So if you have 7 interviews at 7 places and you like all 7, but you like one more than the other, you rank them on the basis of liking.
Okay.
Like you finish that and you lock your list and you submit. Programs also have interviewed 20 or 30 people. They will also rank those people. And if the program has ranked you and you have ranked the program, you will match. If you have ranked a program and the program has not ranked you, there is no match. If a program has ranked you and you have not ranked a program, there's no match. It
Okay.
all depends on if both people have ranked each other at the topmost levels.
Mm-hmm.
And
Right.
then once your matching is done in the month of March, it's usually the second week of March, where the it's called match day, and the match day comes. It's usually 15th of March.
Okay. So, I mean, what is your suggestion basically to the junior ones, like when to actually apply, like right after for the matching, like as you said that you wanted to your profile to, just stand out the other candidates, right? So what you did your step three, then you applied for the
Yeah,
match, isn't it?
yeah. So
So
by step, when I was applying, like I said, I wanted my profile to be the highest
highest.
among all four ads,
Uh-huh.
right? Like, of course, I knew that, like, keeping the reality check, that maybe I'm not as mark at that point. I'm not up to the mark as an American grad, but I wanted to be the best candidate out of all the foreign grads. So when I was applying, I had step one, step two, step three, great scores in all of those. I
Mm-hmm.
had a master's degree that I was completing,
Mm-hmm.
master's in public health. I had a lot of research done. I had published papers, first author papers on my name
Mm-hmm.
that were already published by the time I applied.
Mm-hmm.
So there was nothing missing in my application. There was not a single part of the application where I had to write NA,
Mm-hmm.
not any.
As always, the
That was
perfect.
my goal. My application should not be empty.
Right.
So, and that just increases your chances of matching, right? Think of it this way. If you have a spot,
Mm-hmm.
again, in my head, if there is an American grad or if there's another foreign grad who has everything filled out and I don't have everything filled out, they will pick the one who has everything filled out. It's
Yeah.
natural instinct, right? So
Mm-hmm.
I wanted to be that one. So being able to do that, it's hard. I'm not saying it's easy, but it's completely possible. If
Right.
you have the resilience, then do it. Just keeping the timeline in mind. सबसे बड़ा इशू यही है कि हम सोचते हैं अरे एक एक चीज करते हैं, एक
हम्म,
एक चीज करोगे तो 6 7 साल वैसे ही निकल जाएंगे.
निकल जाएगा. हाँ हाँ.
You have to like be on top of things, right? We have to remember कि हम every year that we are out of graduation, the year since graduation keeps increasing.
So
So
for that I think you need to plan at the right time, right? You need to take the
correct.
decisions at the right time so you can plan accordingly, right?
Yeah.
Right. So
Yeah, like
moving.
you said, right? You mentioned that first second year के बाद ही अगर start करेंगे तो timeline perfect बैठेगी.
राइट, हाँ, मतलब बैलेंस आउट हो जाएगा जब तक आप ग्रेजुएट हो रहे हो. यू कैन बी डन विद योर सेकंड स्टेप, राइट? And then you can go back to India.
Correct.
Whether you want to do MCI or not, it's your choice. And then you can just plan your observerships or clinical rotations in US, and you can just start to apply accordingly, or you can start to apply in your UG itself, and then you can go move
Correct.
ahead with the third step accordingly, right? So it can save a lot of time. क्योंकि I think
Yes.
comparatively, I mean, foreign medical graduates का, as far as I know, I have the information. I mean, it's 6 years in most of the countries. है ना? तो
Mhm.
6 साल तो वहीं चला जाता है. फिर अगर आप you're coming back to India, then you're giving MCI, then you are completing your internship, then again it's like 7 year process. Then you will be like
Yeah.
start to prepare. Yes. So
Yeah.
फिर again, I mean, you will be losing some time. है ना? कहीं ना कहीं जो है
Yeah.
वो एक टाइम इन्वेस्टमेंट एंड प्लस मनी इन्वेस्टमेंट आपका चला जाता है. बट अगेन यस, द फाइनेंशियल crunches are there, or suppose some obstacles are there. Of course, I mean, you can go back, you can just, work, you can clear your MCI, you can work accordingly, and you can just, save the money and you can start the journey. There is nothing wrong in it.
Correct.
And it is always preferable rather, just finding some work in your university time and then not giving your studies time जितना आपको देना चाहिए. आई थिंक इट इज मोर प्रेफरेबल कि
Mhm.
आप अपने एटलीस्ट अंडर ग्रेजुएट टाइम में जो है आप पढ़ाई पे फोकस करें. अपनी जो थोड़ा सा आप अगर प्रैक्टिकल नॉलेज ले सकते हैं, यू आर कमिंग बैक टू इंडिया, यू कैन हैव प्रैक्टिकल नॉलेज मोर. सो
Yeah.
दैट वुड बी बेटर, राइट?
Yes, for sure.
Right. So again, coming back to your specialty, just tell me, are there any particular pros and cons of this branch doing in US?
So problem is I don't have a big point of comparison. My only experience in India is, of course, like that, studying in Delhi, and then my internship time in Pune. So I did my year of after graduating, after passing that exam, I did my year in Pune. Huge difference in the work hours. Work hours in the US are governed by something called as ACGME. You can't work more than 80 hours a week. It's
Okay.
against the law.
Mm-hmm.
So most programs follow that very quickly, very strictly.
Mm-hmm.
In India, like जब मैं इंटर्नशिप कर रही थी 36 आवर्स आप हॉस्पिटल में ही हो 6 घंटे के लिए घर जा रहे हो सोकर नहाकर वापस आ रहे हो सो लाइक ऑल ऑफ दैट इज देयर दे मेक यू डू अ लॉट ऑफ स्कट वर्क एज इंटर्न्स लाइक तुम इस पेशेंट को यहाँ तक ले जाओ उस पेशेंट को वहां तक ले जाओ क्लिनिकली इतना काम इतना नॉलेज नहीं मिलता है दिस नॉट अ लॉट ऑफ टीचिंग
Oh, sure.
हियर इन द यूएस every day we have morning report like in my residency every day we had morning report where the overnight team who was working overnight picked up an interesting case and presented the case during morning rounds which is like so you let me like a day in a resident life is start come in at 7
Mm-hmm.
7 to 7:30 is handoff where you take over from the night team.
Mm-hmm.
7:30 to 8 o'clock is morning report where the night team presents an interesting patient.
Mm-hmm.
8 o'clock to 9 o'clock is pre-rounding, where you look up the patient's, so it's electronic. The whole medical system is electronic. So you look at the patient's chart, you look at the blood test, you write down the blood test, you look at the highs and lows of the blood pressure, temperature, all vital signs,
Mm-hmm.
look at consult notes, if there are different consult notes, and then start rounds. Rounds are bedside rounds where you stand at the patient's bedside and you present your patient, which is very, very formal. It's very formal. It's called the SOAP format. SOAP, subjective, objective, assessment, and plan.
Mm-hmm.
You present your plan. You have to make your own plans as resident. It's not like senior ने बोला वही करना है. नहीं. इंडिया में वो था कि senior ने बोला है इसको ये सर्जरी करनी है ये हो जानी चाहिए. यहाँ पे कैसा है they help you to become the clinical decision maker. They are like, what is your plan for this patient? What do you think the patient has? And what is your plan for the patient? Of course, they have more experience. और ऐसा नहीं है कि what you said is wrong.
Mm-hmm.
The approach is, that's a great plan. But if I were you, I would have done it this way.
Mm-hmm.
So it's more of teaching, more of involvement, there's a very big culture of respect. If you're a resident, you're a senior resident, you're a fellow, you're an attending, the level of respect is the same for everyone.
Mm-hmm.
In India, what I had experiences in my internship were like, अरे यार ये लड़की है orthopedics rotation क्यों करना? It's required, right? You have to do a month of orthopedics. What is she going to do in an orthopedics? Come to clinic one day and then like take the whole month off. That's what I had. I never attended an orthopedic surgery. In my hospital currently, 6 out of the 7 orthopedics residents are women. 6 out of the 7. So there is no gender bias, which is my biggest concern in medicine. There is no gender bias. Our most favorite neurosurgeon is a female and she rocks it. In my residency, the best transplant surgeon was a 41-year-old lady from Russia. She's a Russian doctor and she's the best transplant surgeon in my residency program. And she's 41 years old. It's great to see there's a female surgeon walking. There are 10 men walking behind her. Right? That kind of thing I have not seen in India. That respect that a female surgeon or a female physician has is not what I saw in India. Definitely, there are different pros and cons. In India, there's low resource. So you learn to learn a lot of things in low resource. Right? बहुत low resources हैं यार. There's not enough nurses. You're pushing the patient say by yourself to the radiology unit. In America also you do that. Like I do that because I need to get things moving. But the amount of resources, like gauze तो ऐसे ही फेंक दिया जाता है. Like, they're like single packet gauzes होते हैं. Single packet. One gauze is in one paper packet. So the resources are definitely more. But then of course, then you start getting spoiled. And for me, it was very important that I don't lose my roots. Roots from where I'm coming was very, very important to me because it helps me to become a better person. My residency, interestingly, had 2 tracks, which is a general pediatrics track and a pediatrics global health track. I chose the pediatrics global health track. And during my global health time in my residency, I went to Tanzania as a physician. It's a global health physician. And I went to South Dakota, which is an Indian health reservation, people who have not seen a doctor for 30 years. So I was able to do all of that. I was scheduled to go to Cambodia, but like Cambodia, the clinic where I was supposed to go drowned in water. So then I couldn't go there. But then I did a lot of global health and it changed me. It still kept me connected to my roots of coming in from a low resource country, but also kept me valued and kept me grounded to where I come from and what I want to do in life. So all of those things, like picking and choosing what you want in your life. क्या है आपके लिए important? पैसे तो आने ही है. तुम कुछ भी काम करो, पैसे तो आएंगे. US में minimum pay is $18 an hour. If you work as a janitor or you work as an Uber driver, you will get the money. The money is not the issue. The issue is what you want to do with your education. Like who are the people you want to help? There is of course that elite class of people in the US also जिनके छोटे बच्चे को 1 centimeter का laceration आता है तो oh I want plastic surgery and I was like you don't get plastic surgery, you get me. So you have that kind of people also, but there are also kids who come in the middle of the night sick, very very sick, and you treat them and they go home happy and their parents give you a hug before leaving. It's like thank you, we've not seen a doctor before. So you have that spectrum of patients will be everywhere. It's what you want to do, that goal of your life, right? To help people with your education. And most of us, like all doctors, are in this field because it's a noble profession. Of course, there are some of us who want the money, which is great. Everybody's goals are different. But that nobility of the profession is like always I've seen at the top, and you get that in all countries. India ho ya US ho, wo nobility har jagah pe aayegi hai.
Yes, true. True that. So
Yeah.
since you touched this topic, let me ask the next question कि approximate salary कितना मतलब एक डॉक्टर expect कर सकता है after they get MASH and they get into residency?
So there's a couple of things. When you're in residency or a trainee, your salary comes from the federal government. So in residency, your salaries are very, very low. Your salary is lower than that of a nanny. Like a babysitter se bhi kam salary hoti hai.
Okay.
So it can range anywhere from $48,000 a year to around $60,000 a year. That's the range.
Okay.
When you become a fellow, it becomes from $60,000 to around 85.
Okay.
That's your fellowship. When $1,000 to anywhere to 800,000.
Sorry, can you come again? When we are in fellowship, what is the range?
So when you're in, so residency range is 48 up to 60.
Okay.
And this is ballpark. This is not like standard figure. This is ballpark depending upon your location. Fellowship is 60 to 85, 88. And attending is 160 up to 800,000.
Okay. And what about the taxations and what it includes and everything?
So there's a lot of tax cutting that happens in the US. It all depends on state.
Okay.
Florida and Texas have no tax. They only have main government tax.
Okay.
Most other states have state tax. New York is the highest taxable state where 40% is state tax. So if you're earning $100,000, your take home is only 60,000.
Okay. Got it. So,
yeah. But you have to remember, tax is like if you earn more, you'll pay more tax.
Okay, you'll earn more, you'll pay more. It's more or less.
Exactly.
Okay.
Yeah. तो तुम्हें कम कमाना है, कम टैक्स भरना है, कम टैक्स भरो, but कमाना कम पड़ेगा.
But you will have your own benefits also, like मतलब जैसे insurance का and everything other benefits do we get over there?
Yeah. So when you start a job, especially when residency fellowship, it's mandatory for them to give you benefits.
Okay.
Benefits include sick leave, benefits includes insurance, and benefits include parental leave.
Okay.
ये 3 चीजें mandatory होती हैं. So like I have insurance from my hospital and it's pretty decent. Like I get all my workup done. I do my yearly exams. I go to the dentist. All of these things are all covered for me. All my medications are covered. So there's never been an issue with insurance, especially.
Okay. So, and what other benefits we can get? Like, suppose, for example, just say, just say, like in some countries, there is like कि आपको जैसे जो आपके spouse हैं या फिर family support है या फिर like जैसे maternity leaves भी हैं for the females, right? So, what other benefits, if you can just put some light on this thing?
So depending on the visa you're on, if you're on an H-1B, your
Mhm.
spouse is eligible for H-4, which is a working visa.
Okay.
If you're on J-1, your spouse is not, your spouse gets a visa, J-2, but they are not work eligible. They can
Okay.
come and stay with you. But again, if they're not work eligible, it becomes an additional financial liability. 8% ko khilana versus 2% ko khilana.
ठीक है.
Maternity leave, most places is 6 weeks, six
Okay.
weeks paid leave.
Mhm.
Paternity leave depends upon the institution, but most maternity leave is 6 weeks.
Six.
Most places in the US are breastfeeding friendly, so you can breastfeed, you can pump at work. You will have dedicated time to leave your workspace and pump and have a refrigerator to store pumped milk.
Okay. And are there any, like if you don't have a job, for example, if in most of the European countries, I can, there is like unemployment if you're facing going through it. There are some, security money government gives you for that. Are there such kind of things in US as well?
Sorry, unemployment benefits in the US are only for people who are citizens. If
Okay.
you are unemployed on a visa, you go back to your home country.
ठीक है.
Because your visa is sponsored by your institution. अगर
Hmm.
आपके institution ने आपको निकाल दिया, so you have no reason to be in the US. You have to pick up your bags and leave.
Right. So, is there any possibility that a resident can get into the citizenship or the resident or something for US?
Yeah. So when you're on a visa, it's hard. It's many years because if you're an Indian national, the
Mhm.
visa, sorry, not the citizenship, the green card waiting time is anywhere between 10 years to 15 years from the day of application, not from the day you arrive in the US.
Okay.
Around 15 years to pakad ke chalo, if your institution applies for your green card, but that green card cannot, the green card application cannot be done when you're in training, cannot be done when you're in residency, cannot be done when you're in fellowship. Can
Okay.
only be done if you apply, if you get accepted for a full job.
For a full job, right? Okay. So, have you faced any setbacks during this journey, Diksha? There were any?
100%.
Mhm.
Like there are so many setbacks. I would say starting with like personal setbacks would be trying to figure out residency and masters at the same time, not compromising either, still maintaining a 4.0 GPO, but still being a good resident was hard. It was very hard. My first year of residency was very hard because I'm trying to do both.
Okay.
Still working 80 hours a week. Again, when you come into during residency, my residency had a huge setback and it was not completely hampered, but it was difficult because it was through COVID. I
Mhm.
started residency in 2019
Mhm.
and I finished it in 2022, like 3 years, right?
Mhm.
So that was like 2021 was peak COVID.
Mhm.
Finished half. I was senior resident during COVID. I graduated during COVID and applied for fellowship during COVID.
Mhm.
In my head, it was hard because I was applying to the most competitive pediatric specialty. I did not just think of any other specialty. Peds emergency medicine is what I wanted to do, and I decided to apply there.
Uh-huh.
I applied to about 60 programs, 60,
Okay.
and I got around 12 or 13 interviews, including some of the good Ivy Leagues. Like I was interviewed at Yale, I interviewed at Harvard for my fellowship. So that was like very fortunate. I felt very lucky about that. I did a lot of research during residency. Fellowship is an academic position. So you have to do a lot of research. So by the time I finished residency, I had 11 first author papers. 11 first author papers that were published in big journals, big conferences. So that helped a lot. But to do that with residency and also doing research simultaneously, publishing at the same time, writing manuscripts, proofreading them, submitting them, getting permission, all of those things are hard. It's hard. It takes a lot of toll from you. But again, because if you want to be in an academic position, you need to have research.
Right.
Advantage for me that I already had a master's in public health. A master's in public health is a research degree. So I had that already. So that was helpful during fellowship application. Big hardships are to move. I did my residency in Minneapolis. I moved to New York for fellowship. It's moving halfway. Again, it's easy to make friends when we are 10 years old, but it's hard to make friends when you're 30s.
Yes.
So coming to New York in my 30s, and I was like, okay, and I'm starting a new life, new fellowship. I need to make new friends. I need to adapt to a new hospital system. I need to adapt to everything new. So keeping that in mind, wherever you are, people apply in the same place and sometimes match in the same place. Most programs try to take different people so that there's like variety, there's more knowledge that's shared, that's that comes in. So doing that is hard. Again, same like going from India to Russia. सब कुछ नया, सब कुछ दोबारा शुरू करो.
Zero से.
Zero say. So that was hard. It's also hard to still feel homesick. I've been here in the US now 10 years. I literally, no, I'll finish 10 years in January again when I came here in 2014, December. So I'll finish 10 years, no, 2015 January. So I'll finish 10 years in 2025 January. It's been 10 years I've been here. 6 years of that have gone in residency and fellowship. 2 years have gone in 2 or 3 years have gone in my master's. So I have like 1 year that actually was just studying.
Wow.
So 10 years, not taking a break, not done anything else, just train. Bura lagta hai. Of course, you feel bad. Your colleagues like mere college ke friends, right? They are now married. They are both pilots. Unka ek beta hai. You feel bad. You are missing out on the other things of life. But again, you have to choose what you want. You have to choose what your goal is. And I'm not saying they are right or I'm right. Everybody is right in their own scene, but like it depends on all what you want. I do feel bad. Honestly, I feel bad, right? I'm a pediatrician. By occupational hazard, I should have had kids by now. But it'll come in due. Right? Occupational hazard है. तुम pediatrician हो, तुम्हारे बच्चे नहीं हैं. Right?
Yeah.
But those are the things. It's not that I'm giving up on those, but I'm keeping my time for those. So those are like some of the hardships. There's more emotional hardships than knowledge hardships. Knowledge is like every day. Padhai karo, read articles, read research papers. When you are in a discussion in medicine in the US, people don't talk about nashte mein kya khaya.
Right.
People talk about, have you read that new research article? The
Deeksha,
number of patients they chose in that article.
I'll apologize
Study.
just to stop you
Yeah.
here. Let's continue in a while. Yeah, if it's fine.
Sounds good. Yeah.
Yes.
Yeah,
Okay.
it's fine.
Okay.